Hi there, Dr. Sullivan, Chronic Pain GP once again, and in today's fifth video, I'm aiming to have a quick look at how appropriate reassurance and explanation can go a long way to helping patients come to terms with their chronic pain diagnosis. So, within the chronic pain setting, I would describe the process of reassurance as one which removes the patient's anxieties, fears and concerns about their chronic pain diagnosis. In some conditions where the diagnosis is quite a difficult one or there is no clear-cut diagnosis, I often bring patients back perhaps a couple of times in order to strengthen the doctor-patient relationship and also to try and make sure that the patient actually understands a little bit more about their condition. So when giving reassurance, I feel it's appropriate to take into account the patient's intelligence level, their background, their cultural background, and how much research they may or may not have done about the condition. There is no correct way to give reassurance, and I think it largely depends on each individual patient. But what I do know is that inappropriate or negative reassurance can often lead to increased disability, chronicity of the condition, and also likely to mean that the patient actually accesses healthcare more than they probably need to. It can also cause the patient to move around different clinicians, asking for, in essence, a second opinion. One of the methods I use to deliver reassurance is using cognitive framing, and here are examples of some positive and negative cognitive framing. So, for example, I tend to use more positive cognitive framing. So for example, I would often say to the patient, you're likely to have less pain long term if you exercise, stretch and strengthen. I tend to avoid negative cognitive framing. For example, you're likely to get much worse if you don't exercise, stretch or strengthen. As mentioned in previous videos, I often use the patient's ideas, concerns and expectations to guide me about how I can communicate reassurance. Good, effective reassurance can be very helpful for patients, and there is some evidence that in particularly lower back pain, effective reassurance can often last approximately 12 months or so, and this was borne out in a study done by Traeger and colleagues in 2015, and I'll post the link down below in the comments section. An appropriate explanation in a language that a patient understands is likely to reassure patients accordingly. So some of the techniques I use for appropriate explanations are use of professional interpreters, diagrams, often on the internet with the use of Google Images, and plastic models of joints. I often have a supply of these booklets from the Arthritis Research UK, which I highly recommend, and these booklets often cover multiple conditions and are often very easy to read, and they're easily downloadable on the internet. I'll also add the link below. So when providing explanations about specific conditions, I often try and do the following. I often use simple, clear language, use diagrams to reinforce the diagnosis, use appropriate level of language for the patient, be culturally specific if that's what is needed, empathize with the patient as best I can, and encourage lots of questions from the patient. I try to avoid using quite emotive or destructive language, assume the patient understands my explanation. I try my best not to rush the consultation, which is a bit of a challenge in the current NHS. And I try not to dismiss the patient's concerns. I keep the language quite simple and try and avoid medical terminology. As with reassurance, the explanation is often quite specific to the patient and the patient's needs. And I have to often keep reminding myself that the patients are their expert in their pain, and often are living with the pain 24/7, 365 days per year. It's certainly obvious that patients can pick up on the clinician's tone, and therefore I aim to remain fairly optimistic when talking to patients and giving them the reassurance and explanations. They can often certainly pick up on the clinician's tone and manner, and therefore I try and leave them with an element of positivity and self-confidence. I often conclude the consultation by giving them a review period where I'll see them again, and also asking them to put together perhaps a diary or a plan about what they want to achieve before I see them next. So it's definitely clear that providing adequate and effective reassurance and explanation can go a long way in reducing a patient's anxieties, concerns and worries. In my experience, that patients are craving clarity, and this enables them to effectively self-care and self-manage their condition. So that concludes today's short video. Next time I will be talking about acceptance and how we can help patients accept their condition and thereby move forward. Thank you for listening today, and it's just to remind you to subscribe to the channel, like the pages, share far and wide, and leave any feedback below on comments, and I'll try and get back to you as soon as is possible. Thanks once again for your time.